afternoon, everyone. Almost afternoon. We are here at the Oklahoma State Capitol with Representative Kevin West. He's one of our authors of Senate Bill 658, and Senator Rob Standridge will be joining us shortly. We want to first of all let you know we've got some questions for the authors, but feel free. We've got our administrators here today, and we'll introduce them shortly as soon as we wrap up, because I want you to see the team behind what makes Oklahomans for Health and Parental Rights PAC and Foundation. Not only do we have this team, but thank you to all of the volunteers and all the activists that made this bill happen. It was a lot of work, and we didn't think it was going to get to the finish line, but there at the very end, it came all together, and Governor Stitt actually said it was one of his favorite bills this year. So we're really proud of it, and we're so thankful to our authors and to all of the volunteers and all you parents and activists out there that made your calls. And go ahead and start putting your questions in. We will hopefully get to them. The only thing we ask is that if we answer those, please don't keep repeating the questions, because we're only going to do it one time. So with that, I'm going to go ahead and we've got some questions that have already been submitted to us, and we'll go ahead and get started. So we've got a question from an advisor of a sorority at OSU, and she says that they move in for recruitment and they need to know if the fraternity and the sorority of student life can mandate masks.
Okay. With a lot of the stuff on this bill, a lot of it will depend, because if that is part of the school, a function of the school, then no, they can't. But if they are independent, then technically they can. I would still recommend that you lean on the precedent of 658, you know, that they're not supposed to require that. And especially if it gets to a point where they're trying to say, you know, vaccinated students don't have to, but non-vaccinated do. That would definitely be a strong point to make.
Right, because that would be where the passport would come in, because you're having to identify medical privacy.
Because one of the main purposes of the bill was to not separate, you know, this class of person and this class of person. You know, if it's being applied equally, then, you know, it's a little bit of a different situation, as opposed to, you know, if you're vaccinated, you don't have to. If you aren't vaccinated, you do have to, kind of situation.
Right. So, so with universities, we've had this question a lot. So talk to us about the difference between this bill. It covers private universities, but there's a part in the bill regarding the mask that doesn't necessarily cover the K through 12 private. Can you talk? That's been a big question. And explain that, because a lot of people don't understand why that was, we couldn't actually do that.
I spent a lot of time with our legal staff trying to get that in there on the private K through 12, and the answer that I got back was that the state legislature doesn't have the purview over the private K through 12 like we do the private universities, because the private universities are still under the Board of Regents, which is a state entity. The private K through 12, where aspects they do coordinate with the State Department of Education, we don't have that type of authority to tell the private K through 12 schools something like this.
Yeah. So guys, that's, again, the private K through 12 do not fall under the Board of Regents like private universities. So if you're in a private university, there can be no mask mandates unless, my next question, what is the piece that they can mandate a mask in our schools? Talk about that.
That would be in the medical setting. So, you know, your nursing schools, your doctor facilities, stuff like that, where you're actually face to face with a patient. They can, there is a carve out in the bill for them to still mandate the mask in those situations. And a lot of that comes into play from the medical field overall. So there was definitely a carve out, and kind of, you know, a little bit on the private universities. I was made aware of the University of Tulsa's return to campus plan, and I wrote a letter to their vice president of compliance, because he's the one that had signed that letter, and the Tulsa regions, where they did not specifically violate 658. There was a lot of things that were at least iffy. And basically what I addressed in that letter was those things. And basically when the students start coming back to campus, they'll be screened, and then throughout the year they're going to have testing. All of that is
all students.
All students.
Not like specifically.
Well, that's how it starts. The return. The part that drew concern for me was after they put all of that in there, then they said, but if you are vaccinated, you don't have to go through the screening, you don't have to go through the testing.
Right.
So, you know, I worded the letter in such a way that let them know that definitely goes against the intent of the bill, but it's also a safety factor, because as we're seeing, if you're vaccinated, you're not 100% immune to catching COVID. And if you're not testing and you're giving that false sense of security, there's a greater chance of spread throughout the student body. So I have not heard back from them on that, but you know, that was an example of you know, a private entity that I have reached out to.
Okay. So, but the bill doesn't stop a mask mandate from happening. The state of Oklahoma at some point could, if things got really bad. So talk about and explain what that would look like.
Yeah, basically the way that the bill is worded is that if the governor declares a state of emergency, then that would open the door for that. Now, a lot of things factor into that, as we all know, living here in Oklahoma, you know, whether it's floods or tornadoes or fires or a health deal, the governor can declare an emergency for specific counties, or he could do it for statewide. So the way the bill is written, if the jurisdiction of that school board is under a state of emergency, then they would have the ability to implement a mandate, medical device or a mask. Now within that, they would have to consult with their health department. They would still have to list what the specific device is, you know, and all of that, and then they would still have to readdress that at each regularly scheduled board meeting. So basically, and I've done several interviews this week on this, and with that part of it, you know, the health department is in constant communication with the executive. So, you know, if the numbers start getting out of line, then the governor could declare an emergency for that area and open that door up. So I feel like one difference in our bill, and I've looked at like what Arkansas has, their bill is just you're not going to mandate a mask, period, which is one of the reasons why their governor called them back for a special session this week. With ours, you know, having that leeway from the executive with the input from the state health department, you know, we don't have to come in and change 658 legislatively.
Yeah, so left that. So basically, even if he declared a state of emergency for a particular county, it would still be up to the school board.
Mm-hmm.
And that's where the parents come
Right.
in, not only with who you elect to the school board, but your
Exactly.
voice and your advocacy there as
Right.
well. So it's not as though it's like a, you know, just an automatic thing. It would still be up to the school board.
Yeah.
So either way, okay. Let's see. Do we have any questions from the audience out there?
There was a couple. One of them he just went over.
Okay. So while we're looking for that, let me ask you, many in our audience might have seen earlier in the week, the House Democrats issued a press release asking for the governor to call a special session to repeal 658, which was we just had the ceremonial bill signing today.
Right.
So what are you hearing up here? Is that, is that anything anybody should be worried about?
Well, that spurred several interviews for me this week in response to that. I don't think that there's any danger of us being called into a special session for this. Part of it is just like what I talked about. We don't have to change the bill in order for this to happen. If an area, or the state for that matter, the numbers get so far out of line, then the governor could declare an emergency, and that opens the door. But you know, one thing I've said in some of my interviews, the legislature passed the bill, the governor signed it, and it's really in his hands and the health department's hands, and the communication between the two. Why would he call us into special session, which would cost the state money, to try to overturn a bill that probably not going to get overturned?
Right.
I mean, I've got it passed the Senate 38-8 and the House 76-18.
Yeah.
But even if we did overturn it, then we're totally giving away that level of authority. So, everyone that I've talked to, there seems to be a lot better communication between the State Department of Health and the executive, as opposed to all of the local health departments. So I think that it would be a stretch, and even if he did call it, I think it would be a big stretch to overturn.
So it's not likely.
Not
No.
likely.
Well, especially since we mentioned that he said it was one of his favorite
Yeah.
bills. So,
Yeah.
so to all of you out there that are getting worried, let's put our energy somewhere else. So, any questions that we need to address yet that haven't been covered?
There's a question not about 658 though, about employees.
Okay, we'll get to that maybe
Okay.
later. Okay, we just want to focus on this bill today. So a lot of people are asking about what do parents do if they feel like their schools are discriminating against their child for not taking the COVID vaccine, even though this bill bans passports as defined as, any way to identify yourself. So what should they do?
Well, the first step would be that local board, whether it's the regents of a university or college or K through 12 school board. Definitely contact your representative, your state senator, because chances are, like I said, we had like 26 that voted no on it. So chances are they voted yes for this
Right.
bill. And sometimes, not always, but sometimes when a state senator or state representative contacts that school board, it can definitely help. But that's the first step. And hopefully that would rectify the situation.
Mm-hmm. Yeah, and I can attest to that because Edmond's schools had put up some language that had made parents uncomfortable. I think earlier, sometime last week, about quarantining students who maybe were around somebody that had COVID. But if you had the vaccine, you wouldn't have to be. And so they reached out to the Attorney General's office, to their representative, their senator, as well as to the school board administrators, and they got that problem solved. There's not going to require testing, quarantine. So it is important to politely advocate for your child. It's and not just to one person, but to all of the different people that are involved with that. Let's see. Suggestions on what children should say or do if they're at school and they're requested to mask, or even told that they're required to, even though we know they, because of this bill, they can't be, and their parents have said, we don't want you to wear a mask. What can the kids do?
Every child is going to be different. Some children are a little bit older or a little bit more mature and can better have that conversation, but definitely talk to your kids and find out what's going on, and then be that advocate for your child. Because to have a child, even one that is very secure in their stance, to have that kind of conversation with an adult is very intimidating. So my first suggestion on that is, just have those conversations with your kids. Let them know that they need to come to the parent as soon as something like that happens, and then the parent would be able to address it with the teacher or the principal, the administration. And I think that would be the best way to do it, rather than just comply and not say anything. I've got a granddaughter, 11 years old, lives in Arkansas, and she is she never has liked the mask at all. And so I know that she wouldn't have a problem letting her mom know if something like that was going on. And it's just informing your child, that they can't force you to do this. And if you are told to do that, if you're getting bullied, anything like that, come and talk to me, and we'll get it resolved.
And speaking of bullying, even on the other side, there can be bullying. For kids who are wearing masks. We as parents need to talk to our kids about, it's a choice of the parents, and if they should, whatever that choice is, it doesn't necessarily reflect their fellow classmates. And we as parents should be careful to teach them that just because a child's wearing a mask doesn't mean this or that. That's We don't know if that child may have certain issues.
And you make an outstanding point. There is nothing in this bill that would prevent you from sending your child to school wearing a mask. If you as a parent feel like that's something that your child needs to do, then absolutely do that. Nothing in this bill would prevent that. But what we don't want is this one-size-fits-all approach. And I think the governor has said pretty much to the effect of that, you're free to wear a mask, you're free to not wear a mask. We're not going to mandate either way.
Exactly. Well, I think we're going to wrap it up, but one of our final questions is, many parents have been told that they need to wear masks on school buses. So where are we with that?
That is something that we are taking a very close look at, to see with the public schools if their transportation falls under public transit or not. But that's something that we're definitely looking into and asking for opinions legally on.
Okay. Are there any other things about the bill that we haven't talked about, or you're getting calls in your office, or things that maybe we don't want to tell our strategy, but things that you feel like we definitely need to work on in the future that maybe was missed or that, we just didn't think about?
Well, I think for starters, this bill put us in really good position, and with the support from the executive is huge. I kind of referenced earlier, like Arkansas. Arkansas's bill was, we're just not going to mandate masks, and so with that, the only way to change that is to call them into special session, which they did this week. Our bill, gives some of that leeway. Like I mentioned, the executive is in constant contact with the health department. The executive hears from the legislators, and we hear from the citizens. So, I feel like, at least for starters, we're in really good shape. Now, as we go through this year, there might be some things that we see that we didn't cover, or that we need to cover, and that's true with just about any legislation.
Bill, right? Yeah.
One part I know is something that you and I have worked on, and it's kind of gotten lost in the shuffle. But that was the very first part of this bill, where the schools have to list, when they do a publication about school vaccination, they have to say, or have an exemption on file. And that's something that you and I have been in this fight for at least 3, if not 4 years, trying to get that across the board. And I think that that's a huge part. And I would end with just saying, the power is, we've given the power to the parents with this bill. We have, so it's now up to you to be diligent, to watch what your local school is putting out, what their policy is, and how they're reacting as we go through all of this. And, contact your school board. I think we've seen, if we've learned nothing else over the last 1.5 years, almost 2 years now, it's that those local elections matter big time. And having your voice out there, expressing what your wants, your needs, your concerns are paramount importance. And all of the interviews that I've done, especially this week, they've asked the question, well, why did you feel this bill was necessary? And my answer to every one of them has been, because parents weren't being heard. We saw it not only here in Oklahoma, but we saw it nationwide, where parents would go to these school board meetings and give all kinds of information about why they wanted to see this go away. And it was like they were just going through the motions to get through the public comment section of it, and then they would go on to the vote. So your voice matters a lot. The legislature listened, and I think the vote totals indicate that. And that was the primary reason that we ran the bill, and that the bill was so successful.
Yeah. And I want to just add to any parents that are out there watching, we're a political action committee as well as a foundation. And so if you're a parent and you're interested in running for your school board, reach out to us. If you're a like-minded individual that believes that parents should weigh in on, health decisions, as well as, we talked about, curriculum and school choice as well, but all of those, if you're a big advocate for parents, reach out to us, inbox us, email us at info@okhpr.com. We have surveys, and like I said, we endorse and fund candidates. So just putting that out there, because we definitely need more like-minded individuals. And we have Senator Rob Standridge that just joined us. Thank you so much for coming. Do we need to, we're kind of,
If he could scooch in just a little bit, or Jana, could you move those cups? Maybe that would help.
Yeah. Yeah, so,
You're probably perfectly placed, actually. So, sorry I'm a few minutes late. Sorry.
yeah, well, you've been doing important things.
Trying,
yes.
we'll see.
Yeah, so we've covered a lot, and we're sort of wrapping up. We may take any questions from the audience. Is there anything new that needs to be asked? But I mean, so this bill was a really interesting bill. It started off as a totally different bill.
Yes.
And then you, there at the finish, I mean, we didn't know that it was going to happen. Kind of share with individuals what it was like those last few weeks, and everybody's just super thankful. And a governor said this was one of his favorite bills. So
I think he said it was the most important bill.
Okay. Well, I was a little
for
off.
privacy, I'll put for privacy, so maybe he
So
meant for
privacy.
But I interpret it as the most important bill. But anyway, between this and the Trump bill, I had a more difficult time than I expected. But
What was the Trump bill? Just for the audience.
it died like, I don't know, Kevin, I probably died like 5 times.
Yeah.
Representative West was my house author, but I'm sure he was aware. I mean, when people don't like Trump, they don't like Trump.
Oh yeah,
Okay,
there's no middle ground.
It's just really bizarre to me. I'm like, wow, yeah. Anyway, but for me, it's about policy. But yeah, this bill started actually about early session. We had a bill from Senator Dom, a different bill that I modified and put in one kind of a blanket anti-mandate. And I think that was Kevin West's bill as well, if I remember right. And so we altered that bill and put in a prohibition on mass mandates, and that was killed on the Senate floor by Republicans and Democrats. And
Wow.
and then Representative West changed the bill. Was it this bill that you changed in the House? Changed this bill in the House, and how many conference committees? It's a record number, 3 or 4.
We wound up, it was 3 for sure.
Yeah, kind of a 4th for you.
Yeah.
Because you had to sign one out
Can you
twice.
explain kind of why something goes to conference committee?
Typically to die. 99% of the time it goes there to die. And so I feel very fortunate. I've gotten a lot out of conference, but typically they die much more often than they don't. Or they wait till the next session. Because they went into conference because they're not quite ready, supposedly. This one went to conference because a lot of members just didn't want us messing with this, honestly. And that's fine. People can disagree. But the conference committee should not go through it 3 times. And we kind of had a little race, kind of a bet going on which one of us could sign it out the fastest. But I'll just tell you, I have an unfair advantage in the Senate. We don't have to have a meeting to sign out a conference. Yeah. He has to have his chairman actually has to call a meeting. And Chairman Rowe, I have to give her credit.
Oh, yeah.
She did phenomenal yeoman's work, and one, getting the bill.
Cindy Rowe.
Yeah, she allowed this to go through conference again that many times. In the Senate, yes, mine did as well, but it was certainly more difficult to get it to go through conference in the House 3 times. But so the fact that it stayed alive and the fact that it's passed is, I don't want to call it a miracle, but it's it's a unicorn bill for sure to have passed at all.
Yeah. Well, and I think we worked that day all day, didn't we? When the bill was signed, we were on Facebook and social media, and though 97-8% of people were so excited and thankful, we had those 2%, like you always do on a bill. Or, why didn't they do this and why didn't they do that?
Definitely.
And we had a lot of people that were upset about the carve out for the nursing students.
Right.
Can you talk about that? And is there anything that we may be looking at to help them, particularly with the COVID vaccine? I think a lot of them are concerned with that vaccine.
The original demand, or carve out, if you will, was much more extensive than the final one. The original one was all health, period. So what I negotiated and we negotiated was to talk about the facility itself. So what the argument on the other side was, okay, we're the School of Medicine for whatever, OSU or whatever, and we can control for our students. So the intent of the bill is that they still cannot say anything to their students. But let's say they go over to Presby to do the rotations. We can't control what Presby requires. Okay. So if Jane Doe is a nursing student at OU, but she's doing her residency or whatever, rotations or clinicals at Presby, then they require a vaccine, and OU has to say, well, to do that. That's the intent of the bill. Obviously, the schools seem like they're taking it a little further, but the intent of the bill is that yes, you can, the bill specifically says you cannot make the enrollment contingents or the attendance contingency on the vaccine with no exceptions. The exception is for health facilities, not for the school. That's a health school. So that's I guess become a gray area with my conversations. I don't see it as gray, but the schools are seeing it as gray. That's allowing them to do it for their schools. With the language clearly says, it may take a legal challenge to clarify that language, but the intent of the bill and the conversations in the legislative history, I think, go to the fact that it's about the facility, not about the school.
So do you think?
And that was required to get it heard.
Yeah. Well, and that's the thing. A lot of people think this is easy.
No, it is not easy. No.
It is not easy,
No.
and that's why I wanted
Not to get
speak
stuff
to
done.
it.
It's easy to get into office or to be in office, but like Representative West, I mean, it's not easy to actually get stuff done.
Yeah.
So
And
you could draw your check and live here.
Right. Yeah, and so to that particular issue, would you think there would be any hope for those students if we're able to work on the hospitals themselves? Like, say if they give more choices to their healthcare workers, because we know that's a big issue right now. The healthcare workers are wanting choice with the
Right.
COVID vaccine.
That's right. I agree with that.
Yeah, so maybe we can in the future, the students, if the healthcare workers in those hospital settings have choice, you would think that also the students might.
This is the challenge that probably needs to be brought forward. Let's say that, again, a nursing student, Jane, is going to OU nursing school, and then she gets her rotation at Deaconess that doesn't require the vaccine. But then OU is still saying you have to have the vaccine.
Yeah.
There's the legal challenge, because I believe that she doesn't have to have it in that instance, because the place where her rotation is. So that student's going to have to look for a place to do a rotation or his rotation that doesn't require the mandate and or doesn't require the vaccine. Once that location is found, I think the bill is very simply says that they do not have to have it to stay in school. But that may take a legal challenge, or at least a conversation with the school saying, this is the way we see the law. Maybe a lawyer needs to get involved. And maybe the school will back down a little bit and say, okay, you're right. If you don't have to have it to go to Deaconess, why would we require it? Because that's the health facility. So that's the student we need to find.
Right, okay. So you heard it out there. And it's interesting when you bring, say those two words, legal challenge, that often they do back up the
Yes.
school or the facility. Not only just that, but with the advocacy of hundreds, if not thousands, of parents. The combination of those two, we've seen a lot of backing up, even just in the last few weeks.
Yes, you're right. And I think I would encourage anybody that's watching or hearing about this, I would encourage them to join your group, absolutely, and contribute, because it takes money to stay alive.
Please.
But you've got to let your voice be heard. And for medical students out there, I mean, I've gotten lots of emails and phone calls, and I wish I could reach out there and help them. And I have had conversations, and Kevin may have as well, with the schools. There is some confusion there. I'm not going to throw them under the bus completely. Maybe they think it's confusing. Well, again, we need that student or students that are in that setting I just mentioned. And they need to join your group. They need to let their voice be heard among the thousands of others that are there. And I would definitely say thousands, not hundreds. But just at the Capitol alone, we have hundreds.
Oh, yeah.
So out there
Yeah.
in Oklahoma, especially rural Oklahoma, I think we have a lot of people that are more and more every day wanting to control their own health care.
Well, we've had several thousand just healthcare workers alone join our group in the last 3 weeks since the mandate started. That's not even including, all the parents. So
while they're pro-choice, liberals should be joining as well, because they demand choice over health care.
Well,
Where's the Roe v. Wade people?
Yeah, I'm not sure that's happening yet.
I know. On this issue, they should be part of your group. But yeah.
So, okay, so my last question to you, and I think because a lot of parents, especially I'm seeing Tulsa, and I don't know, you might be able to speak to what Norman's doing, but Tulsa definitely this week, Tulsa Public Schools came out and said they are, what's the word they use? Encouraging.
Right, encouraging.
Well, they said there's an expectation.
Oh, expectation.
Right.
So let's just clarify verbiage and words and just make it very clear that the expectation, wouldn't it be that you would follow the law? I would think.
Yeah, the law is clear, and what's always bothered me about the mask and made me more passionate as the session went on is I continue to see leaders, education leaders in Norman public schools out and about in big groups and everything without masks and showing up the next day and demanding every student wear a mask. Well, you know, kids are easy to control, especially if they're not yours. Yeah, so I can tell you that from first-hand evidence.
Oh yeah, we can all agree to that.
So controlling children is a power trip in some ways. So it bothered me that I would see somebody one day, and I would demand of them, by the way, personally, to stop doing the mask mandate. I can show you my text, many texts, but they would not acquiesce. I mean, they're going to go and not wear one themselves when they're actually at risk. I mean, if you look at the stats, they're actually at risk with the disease, where children are with non-compromised situation almost at zero risk. So they're going to go to school the next day and, as overlord, make all them wear one when they don't wear one themselves outside. I'm sure they wore it then.
Right.
But that began bother me more and more, which makes me see it more as politics and more as controlling than it is about health. And so, anyway, the masks are an issue. The bill is crystal clear. The bill says without a health emergency, you cannot mandate a mask. And we made it perfectly clear that you can't use it as a quasi-vaccine passport. So you can't wear it, make just unvaccinated kids, even if there was a health emergency, they can't just make unvaccinated kids wear masks. So.
Yeah, that was beautiful because we're seeing already so many people concerned about bullying on both sides.
Yeah, I've
so
gotten that call. A
to...
reporter asked me that earlier this week. Maybe Oklahoma Watch, I think, so asked me that. I don't know if she asked you the same thing, Kevin. But and again, I know probably your time's up, but one thing that bugs me on this as well is in the health world, and actually in any world, you look at the positives and negatives. And even if we want to give up and agree, okay, masks may help a little. I disagree, by the way, after research, but let's say I want to give in on that. It's okay, but you got to also weigh the negatives. You lose all nonverbal communication. You get the contamination. You get the misery. I mean, some children, not all, but some children, you really get miserable in these masks. A couple of my kids, one of my kids that doesn't bother at all. The other two hate them. So every child is different. So that's all your negatives. Give me the positives. And so when you start weighing those, even in a purely medical, scientific way, I don't see how the positives outweigh the negatives at all on the mask mandate for me. I'll have to wait and see more evidence come in on the positives before I start thinking the mandate is anywhere close to good.
Well, and one of the things I had said along those lines was with the mask, I'm not totally discounting that, but there are so many more effective things that we can do. You know, just the washing your hands. I mean, you know, look what happened to our flu count last year. You know, people are paying attention. They're not getting in those close situations. You know, so your things like your social distancing and the cleanliness, I think, far outweigh what the mask can do. But you know, if you believe in masks and you think that gives another level of protection, you know, this bill doesn't stop that.
Yeah, and I say for the immunocompromised kids, you're giving them a false sense of security. I mean, telling them they're going to go to school with a Superman cloth mask on and all of a sudden they're protected, I think it's totally giving them a false sense of protection. If you really wanted to use a mask in the way it was intended for an immunocompromised child, you'd send them with a respirator style mask and a 95 type mask, and you have them change it as it's contaminated throughout the day. And use some other type of protocols, like Kevin says, along with that. If you and your physician want to develop a protocol like that for your immunocompromised child, you could probably truly give them an extra layer of protection like a surgeon does. But outside of that, which will probably never happen, again, the little cloth masks, I think studies will eventually show, as some have, the Duke study and others have kind of showed already, they're really probably not doing anything at best.
I got one question for Rob, because he's got some medical experience. Because I've heard this one a lot, I'm sure you have as well. People say, well, if masks don't work, then why have surgeons been wearing them for years?
Yes, surgeons wear masks, but actually there's some large surgical groups that claim that masks done, and they've got studies to back them up that say they don't really do much for post-operative infections. It's about cleanliness and sterile environment, not about masks. But even if you want to give them the benefit of the doubt that they work, they're not used in this manner whatsoever. The respirator type masks, they're put on, they're discarded. You don't go in a patient's room, one patient's room, and then go into another patient's room to perform surgery, two different patients with the same mask on. they're quote contaminated. And so if we wanted to use them as surgeons use them, maybe you could make a better case, but that will never happen. You couldn't enforce something like that ever. So what we're doing here is we're actually potentially contaminating with you, taking it to Kevin and taking it to you. I mean, who knows what we're doing.
When you drop it on the bathroom floor.
Right, and you know, I talked to one reporter the other day, I don't want to throw her under the bus, but she was giving me a little flack about my contamination. She said, well, I saw your stuff posted online, but it's not something I can reprint. I said, well, you don't think they're contaminated? No, I don't know, there's not studies. And then she told me about a study her and her daughter did last year. It's just kind of a play around study with a cell phone to see if that gets contaminated. I said, what's your study show you? Oh yeah, it gets contaminated. How could you think, well, tape it to your face for 6 hours.
Oh, wow.
Imagine the cell phone taped to your face for 6 hours, you think it's contaminated now. So yeah, so it's not rocket science to figure out that they will be contaminated. Now, whether they're dangerous or not, studies will probably eventually show. I think they are. I think in certain cases, it's possibly more harm than good. And to get back to the Superman mask, the cloth masks have been shown to actually exacerbate. In other words, they'll make a non-infective viral particle an infective viral particle by breathing in and out of the mask. Anyway, long conversation, sorry. Details.
Well, I think that's a wrap. Do we have any questions?
There's a couple. So
Okay.
one question is about the part of 658 that talks about the vaccine exemptions. If that is required for schools in just like their enrollment handbook or like anything they put out on social media that mentions the vaccine requirements, is it required that they also say the exemptions are required in those types of posts?
It would be basically any publication that they put out. If they have that information on their website, it would be included on their website. If it's a handout that they're giving to students, it would be included with that. If it's an email that they're sending to parents, it should be included in that.
Facebook, Instagram.
Yes.
Basically, anytime they mention the requirement, they also have to mention the exemption, right?
Yep. The exact language I have right here is.
This was the original bill.
Yep.
Mm-hmm.
In any notice or publication provided to parents regarding immunization requests.
Okay. And the only other question, I don't know if you mentioned this, can the district require that teachers wear masks?
I don't think it addresses students though. I don't think it addresses that because it doesn't address it specific to students, right?
Yeah, it's that a school district cannot mandate.
That's what I'm thinking. So I've had that question asked for higher ed. Higher ed's a little trickier because it's talking about a role in attendance. So I think faculty are more at risk at higher ed. And
They
Common Ed,
can't. I think they mentioned that.
I'd have to review the language, but I think the Common Ed is all protected.
So they cannot make, so you guys are saying that teachers,
I would much more
Might be
lean
covered?
towards that they can't mandate it for the teachers.
In Common Ed.
In common.
I've had staff look in higher ed and I believe that staff is at risk to be mandated in higher ed because it talks about attendance and enrollment. But in Common Ed, it just talks about.
And does that include other employees at the school? So maybe your lunch lady or the janitors or support staff, principals maybe?
They might be able to argue that it's not a mandate if we're just asking certain employees to wear it. So yeah, they possibly could get around it for employees or teachers. I mean, I could see them saying, well, it's not really a mandate, it's just for certain employees. Yeah, I don't know. They'd have to argue their case.
So people in that case should probably talk to their superintendent, maybe an attorney.
Correct.
Okay.
But it isn't specific to students if memory serves on the Common Ed.
Okay. And then the only other questions are just about employees, not just school, but nurses and people worried about their employment.
This bill unfortunately doesn't go there.
okay. What I can say to that is we are definitely working with the executive and many of the legislators on that issue. Can't give too many specifics on that at this time because there's too many moving parts, but we do want to let you know that they're definitely moving and they're definitely hearing you guys. There's also the lawsuit, again, that word legal challenge. So if you are interested in being in on the lawsuit against the hospitals, because we're mainly focusing on the healthcare workers, and I know that that is frustrating to some people that aren't in healthcare, but we feel like this is first going to be the biggest piece, and if there's success here, then the other areas will hopefully be covered. So please reach out via email to info@okhpr.com and let us know if you're interested in the lawsuit, and we will forward that on to the attorney who's taking the case. The lawsuit will be filed very soon, and we also want you to join our organization, because when you join our organization, we send out a weekly newsletter with all of the updates. There's no way. We're so overwhelmed. We have been working more than part-time the last 2 weeks, and it's a good problem to have, but we need you guys to really read your text and your emails and our newsletters, because we cannot individually reach out anymore. We've got to put out the information to thousands, because we're looking at, like I said, our organization quadrupled over the summer. So with that, just join us, and we will give you information on that in the next few months. There will hopefully be some movement on that area. But yeah, this bill doesn't specifically cover that. It's about parental rights. And we're so thankful. I want to quickly introduce the parents here that are, the wind beneath my wings. If you don't know who I am, I'm Liza Greve. I'm the executive director. And we're probably going to have to turn the camera. I want to introduce these ladies. We hardly ever get together. We don't ever meet in person, except like on Capitol Days. We do everything through technology, and that's why I think we get so much done, because we don't waste time with meetings, in-person meetings. But where do you want to start, Miranda? Should we put it on you, because you're the assistant director?
If someone else wants to.
Yeah, let's put it. I just want to quickly introduce. This is Miranda Jones.
Oh, we have
the
Facebook too.
Director.
Maybe I should. I don't know.
And she does she's responsible for the website and all of the main big pieces of communication and the technology that, like, I feel like I'm too old to master. And we've been together since the beginning. So we're going on 7 years as a PAC and 3 years as a nonprofit.
Yep.
And then we've got Emily Waits here. She's our master. Her and Nikki, you guys get together. They are our social media coordinators. So when you reach out via social media, you will probably get them. They vet everybody that joins our group to make sure it's a safe place for parents to discuss, and they put a lot of work behind the scenes. They have full-time jobs and very busy moms, but they still, for 7 years, have volunteered. And so we're so thankful for them. And then let's flip it around to Jana. Jana is our captain's coordinator. So we, the only way that we have been able to survive the last 6 months is we have an infrastructure of Senate district captains, because we cannot, I cannot reach all of our members. And so every Senate district has a point person, and even some of our bigger districts, like her district, Senate District 22, Jake Merrick's is huge, as well as mine, Adam Hughes, and we have several coordinators. So she is the one who vets them, she interviews them, she sets them up. And you have how many chats going? And
Too many.
Don't tell Zuckerberg, he might shut us down, but she's got probably like 40 chats with all of these groups. And that is where, because Facebook shut our action group of 15,000, almost 15,000 down. They disabled it. I don't know if you're aware.
Has it not come back up yet?
No, it's still disabled. We had to start it fresh. And so now we're working on other ways of communicating, including text. And so she's always got that going. And so she's, a huge part of making our leaders feel comfortable and getting their questions answered when I can't get to them. So I really appreciate you. And then back there we've got Jessie. She's been our photographer for probably 7 years. Oh yes, and she's our captain of Senator Shane Jett. So yeah. So anyway, and then just lastly, I just again want to thank you all so much. I agree with Governor Stitt. This was the best bill. I mean, I don't even think we know how many people students who we've helped by just giving them the choice. That's all it's at. We're not stopping anybody from, getting the vaccine or getting the mask. It's just, or identifying if they want to identify their their vaccine status. It's all about choice. And so you guys made it happen, and from the bottom of our hearts, from tens of thousands of parents and individuals, the nation's watching Oklahoma, and you guys are a part of that. So, any last words to parents out there and people in other states that are watching.
Just want to thank you guys, and the grassroots is what gets things like this done. So thank the grassroots, thank the parents, and I mean, it's on education. You mentioned, alluded to that earlier.
Yes.
I think we have to have more education choice. Parents should be in total control of their children's health and education, everything else, and I think that's the way God intended it, and that's the way it should be. And I think this bill, I think makes a lot bigger statement than I think we thought it would make a few months ago, because we were hoping we were on the decline, but the politics are ramping back up, and the control people are ramping up. So, yeah.
Well, I could just say ditto, but no, the grassroots, the individual parents, like I said earlier, that's what really drove this bill getting across the finish line, getting to the governor's desk, was hearing from parents. And so, just because we have this, you cannot let up. You have to be diligent and keep an eye on what's going on in your kid's classroom.
And with that, we will let go, and just to let you know, those that are watching, all of our haters, we will be moving more into the area of school choice. We think it's all about parental rights, and so as we get the time and as legislators come to us for help, we will definitely be there for school choice as well. We've actually added that to our core values, our website. We're not just about the health aspect anymore. We feel like it is all an important piece to how our children are going to be raised, and it needs to be done. So with that, thank you all so much, and we're signing off. Bye-bye.